Hi, everyone.
Hi.
Hello.
All right.
Good
It's
afternoon.
2:02, so I think we will get started. For awareness, I have started recording of this presentation and conference call, and that will be posted on iSupplier along with any questions that come through. My name is Elise Kittner, and I am the Director of Laboratory-Based Surveillance in the Disease Control Bureau of CDPH. And I will be walking you through the RFP today. If you have questions, please utilize the chat function in Teams and post your question there. We'll do our best to respond to questions on the call today, but then also anything that's submitted between now and the deadline, we will post those questions and answers on the iSupplier site as well. So a quick review of our agenda. We are going to review the background of the RFP as well as the program description. We'll discuss alignment with the Healthy Chicago 2025 goals as well as CDPH's guiding principles. We'll review the characteristics of an ideal applicant, the RFP scope, and the evaluation framework. We'll have deadlines associated with the RFP at the end of the presentation, and then we'll go into questions. So as background, the COVID-19 pandemic demonstrated the need for flexible diagnostic testing capacity, infection control, and prevention consulting services to mitigate the profound risk of disease transmission within congregate settings and other settings in the context of public health surveillance and response. Early detection and prompt comprehensive public health response are critical to interrupting transmission and protecting high-risk communities. Therefore, CDPH is seeking a contractor or contractors to provide flexible capacity for testing services of COVID-19 and other high consequence pathogens, primarily within low resource congregate settings and other vulnerable populations. There are many CDPH programs which are supported by this RFP and the associated projects, and that includes communicable disease, laboratory-based surveillance, vaccine-preventable diseases, healthcare and congregate settings, syndemics, and other programs within CDPH. The first RFP was released in January of 2022, and 2 contracts were awarded and with subsequential 1-year renewals. This is an RFP for a 1-year contract with 2 optional 1-year renewals. Contractors will be supporting testing needs of various CDPH programs, including but not limited to sexually transmitted infection outbreaks, public health emergency preparedness activities, foodborne outbreaks, hospital-acquired infections, tuberculosis, and vaccine-preventable diseases. There is no immunization component to this RFP. This is a timeline of the work completed from 2020 to 2025 on this project. Here you can see how the scope of the work, the pathogens, and types of outbreaks supportive have evolved. However, the core work remains the same, supporting CDPH's testing needs during outbreaks and emergencies. Testing events have ranged from where the work began with COVID-19 in shelters and long-term care facilities to citywide preparedness for Marburg in 2024. Outbreak support occurred during Mpox in 2022, and of course, the large measles response outbreak in 2024. There is also long-standing support for hospital-acquired infections, specifically Candida auris, in long-term care facilities. This program supports Healthy Chicago 2025 goals as well as CDPH guiding principles. Related to Healthy Chicago 2025, this program improves systems of care for populations most affected by iniquities and furthers the health and vibrancy of neighborhoods. The CDPH guiding principles supported through this work include an equity focus as well as trauma-informed care. The service area includes all wards and demographics across the the city of Chicago because this is citywide testing. However, we prioritize vulnerable populations with high burden, low resource facilities. The ideal applicant meets the required technical expertise, including qualifications and experience in infectious diseases and clinical evaluation. Additionally, experience with management and deployment of response teams is preferred. There's also a large element of collaboration and partnership with various CDPH programs, lead coordinating organizations at shelters, and other testing providers and laboratories. When responding to this proposal, respondents must clearly state the following. The respondent's ability to meet the minimum of one congregate setting testing event per week, as well as the maximum capacity for the number of deployments for a congregate setting each week. And then the pricing for each of those should be provided in Exhibit 2. A primary contract, and if determined by the city, a secondary contract will be awarded to the most qualified respondents. The city will require the primary contractor to provide the minimum services specified by CDPH. A secondary contract may be awarded to the second most qualified respondent to meet its needs in excess of the maximum monthly deployments provided by the primary contractor. Here you can see the evaluation framework for the three reviewers who will be reviewing the applications. Some are points-based and some are pass-fail, and this is also outlined in the RFP application. Here we have a few deadlines associated with the RFP. The next date is July 11th when RFP questions are due to CDPH. Those answers will be posted on August 1, and then the RFP proposals are due on August 6th. And now I am happy to answer any questions you have. Please type them into the chat. Alternatively, you can email me at alysekkittner@cityofchicago.org, and we can include your questions in the document that's posted on August 1st. Are there any questions? When will slides be available? We will post these slides with the questions on August 1st. You're welcome. I'll give it a few more minutes. I'm happy to stay on the line until 2:15. But there is no other content. So yes, if you don't have any questions, you're welcome to drop, but I'll be staying on for the next few minutes. Thank you. Okay, we have a question regarding the reference to marketing, research, and consulting services in Exhibit 4. What is this in reference to? Um, Unfortunately, I don't know that off the top of my head, but we'll record the question and include that in the document that's posted on August 1st. Thank you. There is a question, please confirm the expected volume at congregate settings is 25 people for budget purposes. Um, I believe one yes, I believe so, but I will confirm how it is written in the RFP and include that in the Q&A document. And I will do, it's 2:15, so one last call for questions. I'm happy to stay on. Okay. Thank you everyone for coming and listening and your interest in this work. We'll post, please send me any additional questions and we will post those answers on August 1st. Is the contractor expected to process for their own labs for can we use our LabCorp contract? Yes. Depending on the pathogen, the expectation is that the contractor would provide the laboratory processes. So if that's through your contracted lab or your own lab, that either would be fine for us. Some tests do require public health testing, and in that respect, they would be sent to the IDPH lab. Did that clarify the LabCorp contract question? Okay, great. If no other questions, we will post these answers and look forward to applications. Thank you, everyone. Have a great day. Bye-bye.